Welcome to A Senior Moment. This episode's guest is an LGBTQ advocate, as well as a member of a senior advisory council.
Well, thank you. It's a pleasure to be here and to discuss this topic. So I'm going to begin by discussing who are LGBTQ plus older adults in the US. Well, I think it's important to note that we've actually got some data, and 2.7 million LGBT adults aged 50 and older, according to the most recent data that we have, reside in the US. And of those, 1.1 million are 65 and older. And approximately 1 in 5, that would be 20% of those older adults, those LGBT older adults, are people of color. And really important, and we'll talk more about this, 1/3 of LGBT older adults live at or below 200% of poverty level. And when we look at this population, I think it's really important to note that LGBTQ is not a monolith. It's not a community. In fact, LGBTQ people are members of all communities. They're all ages, all ethnicities, all races, all faiths, all economic levels, and they live literally in every geographic area. So let's look a little bit more at older adults. Well, that's a population that's growing. So I also want to note that in 2030, the projection is that 3.8 to 7.2 million LGBT adults will live in the US. So as we look at the older population, there are 3 distinct generations. And this is important because those generations have experienced really different things, and it impacts them in their older life. So let's begin by the oldest. That is referred to as the invisible generation, people who are 85 or older, and they came of age during the Great Depression. Many served during World War II, and it was at a time when LGBT identities were mostly absent. Then we have the silence generation, people 75 to 80, also called the greatest generation. It's at a time when same-sex behavior was criminalized. The American Psychological Association, the APA, actually defined same-sex behavior as a disorder. And many people during this time experienced violence. They were arrested many that, and I've known some personally that had shock treatments to correct their sexual orientation. And there's also folks that were even lobotomized. So a lot of trauma was experienced by this generation. Then we have the Pride generation. That's my generation, baby boomers and beyond. In 1969, we had the Stonewall riot. It was a time when some of the criminalization began to be reversed or removed. It was also a time when the APA removed sexual orientation as a disorder. But huge, it was a time in the 80s when the HIV/AIDS pandemic began, and it's obviously still with us today. But a lot of trauma during that period, even though things were beginning to change. So important to note that this, again, is a population that is not a monolith. So let's look at LGBT older adults and aging. And when we look at successful aging, there are really 3 key cornerstones: economic security, social connections, health, and well-being. And those are all areas that there are key challenges for LGBT older adults. When we look at economic security, there's a lifetime of discrimination and a lack of legal and social recognition. In terms of social connections, a real reliance on chosen family rather than your birth family. And there's, from a health and well-being perspective, a real lack that persists today in competent, inclusive healthcare. So let's dive in a little bit deeper. First, with economic security, the lifetime discrimination includes housing and employment and a long-term lack of legal and social recognition. And it's important to note about those things that in many states in the country, you can still be fired for being gay, even though you can be married. We have an expression, you can be married today and fired tomorrow. And it's also important to note that marriage equality happened only 5 years ago in 2015, and many older adults may or may not choose to be married. So I want everyone to be very aware of that fact. But all of those things combined together really create deep economic insecurity for many, many LGBT elders. And when we look at social recognition and support, that there's a real reliance on chosen family, and that was due to family rejection. You know, I personally knew folks that became HIV positive that were rejected by their families. I knew women who divorced their husband, had their children taken away from them. There was legalized discrimination, and all of that creates real social isolation and vulnerability for LGBT elders. That trauma of maybe being arrested or not being able to get a job really creates a fear. Now let's look a little bit more at long-term discrimination in the healthcare setting. It all that continues to persist today, and we'll talk a little bit more about this, leads to very specific mental and health disparities. And let's look a little bit more at some of these challenges. So LGBT older adults are 2 times more likely to live alone. So when we think about isolation, there's some data for you. 4 times more likely not to have children. Again, we have to rely on chosen family rather than birth family and our own birth family. More likely to be estranged from family and more likely to rely on friends. Let's take a deeper look at the 1/3 of LGBT older adults that live at or below 200% of poverty level. And this is another way to see how there is not a monolith when we look at this, what I refer to as the alphabet of LGBTQ folks. So for example, when we look at LGBT older adults that are 80 and older, African American LGBT older adults, and Hispanic LGBT older adults, 40% of older adults that identify in those that I just listed are living at or below 200% of poverty level. That increases to 47% for bisexual older men, and for bisexual older women and transgender older adults, it goes to 48%. We also know that when you look across that spectrum, whether it's age, whether it's ethnicity, whether it's being transgender or bisexual, that can vary in terms of how you're impacted by levels of poverty. So let's take a further dive into the healthcare setting and the lack of competent, inclusive healthcare and the poor outcomes it can provide, and quite frankly, the fear that it can instill in LGBT folks. When we look at a study data that showed that LGBT older adults age 45 to 75, they reported the following. 36 reported that their primary healthcare providers were completely unaware of their sexual orientation. 23% were reluctant to even discuss certain issues with their primary care providers because they were afraid of being judged. And 20% had a feeling that their relationship with their healthcare providers, such as hospitals or nursing home staff, would be adversely affected if they revealed their sexual orientation and gender identity. So as you can see, those fears, if you can't reveal who you are and you can't talk about your issues, you can't get the care that you need. Now, when we look at transgender older adults, age 45 to 75, some of those numbers are the same, but most are much higher in terms of the fear and the challenges that they face. So 35% were concerned about being judged by their primary healthcare provider. 44% had a feeling that if they revealed who they were, that their relationship would be affected. 65%, this is a pretty stunning number, 65% felt that they would have limited access to healthcare as they grow older, and 55% had a feeling that they would be denied medical treatment because of their age. So pretty stunning and interesting statistics and reasons why we need to address this. So let's dive a little bit deeper into the actual discrimination and harassment that LGBT older adults have faced. And this particular research study showed that 23% actually experienced physical or verbal harassment from other residents. 20% were refused admission or readmission, or there was an attempt, or they were abruptly discharged. 14% experienced verbal or physical harassment from staff. 11% were refused The staff refused to accept their medical power of attorney from their resident spouse or partner. 11% had a restriction of visitors. 9%, the staff refused to refer to a transgender resident by their preferred name or pronoun. 6% experienced where the staff refused to provide basic care or services. And 6% were denied medical treatment by the staff. So when we look at the key disparities among LGBTQ older adults, this really shows what we've talked about in the prior slides. There's an elevated risk for social isolation compared to heterosexuals. Income is not commensurate with education. If you don't have access to jobs in the same way, you can't make the same dollars. There's more of a lifetime discrimination and victimization. There's higher rates of physical limitation, weakened immune systems, mental distress. Lesbian and bisexual women have higher rates of disability, cardiovascular disease, being overweight, poor general health. Gay and bisexual men twice as likely to live alone and have higher rates of cancer and HIV. Transgender older adults, higher rates of discrimination, victimization, mental distress, disabilities, poor health, and less support. Bisexual older adults, higher rates of stigma, less likely to disclose identity, lower income, less support. Older adults of color and those with lower income and education have a much more elevated risk of disparities, and all face limited access to aging and health support services. And I think this list, although it's exhaustive, really helps highlight that depending on where you fall in that LGBTQ spectrum, whether you're a person of color and what your income will impact what your experience is. So some key adult challenges and issues. As they age, LGBT people are more likely to be caregivers for their friends. If you don't have your family, you don't have children, that's the case. LGBT people are more likely to have health problems like HIV, depression, and substance abuse. 9 in 10, according to one study, expect healthcare providers to discriminate against them. 9 in 10, that is stunning. And LGBT people face high levels of discrimination in assisted living and affordable housing facilities. So what can we do? What can we do as individuals? What can your agency do? We can collect data. And by collecting data, I mean collect sexual orientation and gender identity. You may hear the acronym SOGI. And it is critical to understanding and providing visibility so that the needs of LGBT older adults can be addressed. We can include LGBTQ folks in our aging planning. And in doing so, in state and agency aging plans, it helps to really ameliorate the disparities and help ensure that LGBT older adults are actually receiving the services for which they are eligible and which they deserve. We need to improve cultural competence training across all agencies. And in doing so, it helps really confront the disparities that LGBTQ folks face. It helps providers and people that work with LGBTQ folks properly understand how to engage the population, so people are more likely to seek the assistance that they need. And there's an availability of services where they feel safe that they can go to. And last but not least, it's important that we support the passage and implementation of LGBTQ inclusive non-discrimination policies. And in a state like Oregon, we have a lot of great policies, but the reality is there are a lot of agencies and there are a lot of people that they serve that are unaware of those policies. So we've got to really support the implementation and the education around those things. And we need to continue to advocate for more solid policies to ensure the protection of those folks and to make sure they get the care and the services that they are eligible for and that they deserve.
This has been a senior moment. Thanks for watching, and please consider liking and subscribing.